Good morning, everyone. Welcome back to channel Medical with Sanju. The remaining question of NNC set 22. Question number 76. Child growth and development is affected by option A peers, option B home environment, option C parent-child bond, option D school environment. Child growth and development is affected by home environment. Option B is right answer. This is the most important element. Question number 77. When observing a toddler and other children in the playroom, the nurse should expect the toddler to engage in option A parallel play, option B competitive play, option C solitary play, and option D cooperative play. According to age group, there are different play. So you can see here occupied play in a 0 to 3 month, solitary play in a 0 to 2 years, spectator in a 2 years, parallel play in a 2 plus years, associate play in a 3 to 4 years, and comparative play 4 or more than 4 years. So toddler means 1 to 3 years of child is called toddler, and it play parallel play. Option A is right answer. Question number 78. The nurse is aware that children born with a missing chromosome are most likely to have option A cretinism, option B Down syndrome, option C phenylketonuria, and option D Turner syndrome. Missing chromosome. This is called Turner syndrome. Option D is right answer. Question number 79. When an infant's vomiting is uncontrolled, it is most important for the nurse to assess for which complication. Option A acidosis, option B hyperkalemia, option C alkalosis, and option D hypokalemia. Excess vomiting. It occurs alkalosis. Option C is right answer, and dehydration also. Question number 80. At birth, the length of the baby measure about option A 20 centimeter, option B 50 centimeter, option C 40 centimeter, and option D 60 centimeter. 50 centimeter. Option B is right answer. Question number 81. The range of normal heart rate in a children is option A 60 to 80 beats per minute, option B 120 to 140 beats per minute, option C 80 to 120 beats per minute, option D 140 to 160 beats per minute. Eighty to 120 beats per minute. Option C is right answer. Question number 82. A child can sit with support at the age of option A 6 months, option B 8 months, option C 10 months, and option D 1 year. A child can sit with support at the age of 6 months. Option A is right answer. Question number 83. Toddler means under 1 years of age. Option B 3 to 5 years of age. Option C 1 to 3 years of age. And option D 6 to 12 years of age. Toddler means 1 to 3 years of age. Option C is right answer. Question number 84. Child with cystic fibrosis. Option A gains weight. Option B rarely play. Option C tastes salty when kissed. Option D has a poor concentration. Taste salty when kissed. Option C is right answer. Question number 85. A nurse is putting together a presentations on meningitis. Which of the following microorganism has noted been not listed to meningitis is option A staphylococcal pneumonia, option B H influenza, option C N meningitis, and option D CL difficile. Option D is right answer. Question number 86. What is the primary critical observation for Apgar scoring? Option A heart rate, Option B, respiratory rate. Option C, presence of meconium. Option D, evaluation of maximum reflex. The most important element of the Apgar score is heart rate. Option A is right answer. Question number 87. Getting things done in the definition of. Option A, management. Option B, leadership. Option C, organization. And option D, leader. Getting things done in the definition of management. Option A is right answer. Question number 88. Putting plans into action. Option A, working. Option B, motivation. Option C, evaluation. And option D, implementation. Putting plans into action is implementation. Option D is right answer. Question number 89. In your organization, your supervisors has direct command over the subordinate is. Option A, line authority. Option B, functional authority. Option C, staff authority. And option D, organizational authority. This is line authority. Option A is right answer. Question number 90. The National Health Policy started from. Option A, 1990. Option B, 1991. Option C, 1972. Option D, 1952. The National Health Policy started from 1991. Option B is right answer. Question number 91. The process of selecting a right persons in the right place at the right time is. Option A, leadership. Option B, staffing. Option C, coordination. And option D, management. This is the process of staffing. Option B is right answer. Question number 92. In which type of leadership style there is a feeling of we rather than I? Option A, democratic. Option B, laissez-faire. Option C, autocratic. And option D, communist. Feeling of we rather than I means this is democratic. Option A is right answer. Question number 93. The process of observing whether subordinates are working correctly in accordance with the policy is. Option A, leadership. Option B, communication. Option C, supervision. And option D, evaluation. This is supervision. Option C is right answer. Question number 94. The process of comparing actual performance with standards and taking corrective decision is. Option A is management. Option B, leadership. Option C, staffing. And option D, controlling. Right answer is option D, controlling. Controlling is a primary goal-oriented functions of management in an organization. Question number 95. At planned educational experience provided in a job setting is called. Option A, health teaching. Option B, in-service education. Option C, interaction. And option D, training. In-service education. Option B. Question number 96. Which of the following is not a basic functions of the management process? Option A, controlling. Option B, organizing. Option C, working. And option D, leading. Working is not the function of management process. Option C. Question number 97. Races incompatibility may result. Option A, NNC fallacy. Option B, spina bifida. Option C, thromboblastosis fetalis. And option D, none of the above. Rhesus incompatibility is the hemolytic disease of blood disorders in the newborn. This may result in erythroblastosis fetalis. Option C is right answer. Question number 98. A pregnant woman has a hypertension combined with a proteinuria and generalized edema. What is her diagnosis? Option A, anemia. Option B, preeclampsia. Option C, eclampsia. And option D, none of the above. This is preeclampsia. Option B is right answer. Question number 99. Which one of the following focus the major part of placenta? Option A chorion, option B germ layers, option C decidua, option D amnion. The major part of the placenta is chorion. Option A is right answer. Question number 100. A client in a labor has been pushing effectively for 1 hour. A nurse determines that the client's primary physiological need at this time is to option A ambulate, option B rest between contraction, option C change position frequently, and option D consume over food and fluids. Right answer is option B. She need rest between contraction. Question number 101. An extra calorie required for a pregnant woman is option A 200 calorie per day, option B 300 calorie per day, option C 500 calorie per day, and option D 600 calorie per day. During pregnancy, need of 300 calorie per day. Option B is right answer. And age of lactation, need of 500 calorie per day. Question number 102. The physiological anemia during pregnancy is a result of option A decreased dietary intake of iron, option B increased plasma volume of the mother, option C decreased erythropoiesis after the first trimester, option D increased detoxification demands on the mother lives. Physiological anemia during pregnancy is a result of due to increased plasma volume of the mother. Option B is right answer. Question number 103. At what week during pregnancy the uterus rises out the pelvis and become an abdominal organ? Option A 8th week of pregnancy, option B 10th week of pregnancy, option C 18th week of pregnancy, and option D 20th week of pregnancy. The right answer is option C 18th week of pregnancy. Question number 104. The greatest total weight gain at trimester. Option A first trimester, option B third, option C second, and option D implantation. The greatest total weight gain at third trimester. Option B is right answer. Question number 105. A client tells the nurse that the first day of her last menstruation period was July 22, 2011. What is the expected date of delivery? Option A May 7, 2012, option B April 29, 2012, option C April 22, and option D March 6, 2012. 9 month र 7 days add गर्दा आउँछ April 29, 2012. Option B is right answer. Question number 106. Nausea and vomiting commonly experienced by many women during the first trimesters of the pregnancy is adaptations of the increased level of which hormone? Option A estrogen, option B progesterone, option C LH, and option D chorionic gonadotropin. Right answer is option D chorionic gonadotropin. एससीजी हार्मोनको कारणले चाहिँ फर्स्ट ट्राइमेस्टर्समा मोर अफ द वुमेन्सहरूले एक्सपिरियन्स गर्छ नाउजा एन्ड भमिटिङ. क्वेसन नम्बर 107. The largest part of weight gain during pregnancy is because of option A fetal growth, option B fluid retention, option C metabolic alternation, and option D increased blood volume. The right answer is option A fetal growth. 108. What is the most therapeutic positions the client with pelvic inflammatory disease? Option A Sims position, option B flower position, option C supine positions and knee flexed, option D lithotomy positions with the head elevated. Should maintain lithotomy positions with the head elevated in the case of pelvic inflammatory disease. Question number 109. A sign which indicates the placenta begins to separate from the uterus and is about to be expelled is the option A. Relaxations of the uterus. Option B. Descent of the uterus in the abdomen. Option C. Appearance of a shortened course of blood. And option D. Retractions of the umbilical cord into the vagina. Appearance of a shortened course of blood. Option C is right answer. Question number 110. In pregnancy, there is an increased blood supply to the pelvic region that result in a purple discoloration of the vaginal mucosa, which is known as option A. Larding sign, option B. Goodell sign, option C. Haggard sign, and option D. Chadwick sign. Which type of sign and symptoms occur during the pregnancy? यसको डिटेल क्लास भइसकेको छ, यहाँहरूले चाहिँ लिङ्कमा गएर हेर्न सक्नुहुन्छ. The right answer is option D, Chadwick sign. Question number 111. The most common cause of a spontaneous abortion is option A. Physical trauma, option B. Unresolved stress, option C. Embryonic defect, and option D. Congenital defect. The right answer is option C. Embryonic defect. Question number 112. Zinc deficiency is characterized by option A. Sexual infantilism, option B. Poor growth, option C. Poor wound healing, and option D. All of the above. The right answer is option D. All of the above. Question number 113. Which is the most common cause that leads to postpartum hemorrhage in mother? Option A. Uterine atonicity, option B. Blood coagulopathy, option C. Hypertension, and option D. Trauma. The right answer is option A. Uterine atonicity. Question number 114. Physiological jaundice occur in during option A. First 24 hours of birth, option B. 36 hours of birth, option C. Within 1 month of birth, and option D. Within 1 year. You can see the physiological jaundice and pathological jaundice. Physiological jaundice occur after 36 hours of birth. Option B is right answer. Physiological neonatal jaundice and pathological neonatal jaundice. In physiological jaundice, it occur after 24 hours, and pathological jaundice, it occur within 24 hours. Is the main differences. And other than the bilirubin level is different in both. Clinical symptoms are different in both. Question number 115. Late in pregnancy, fetal head descent in the pelvis and counters of the abdomen change. This refers to as option A. False descent, option B. lightening, option C. Braxton Hicks contraction, and option D. effacement. This is lightening. Option B is right answer. Question number 116. Management of placenta previa are of the following except option A. Vaginal examination, option B. Immediate transfers to the hospital, option C. Complete bed rest, and option D. Accurate assessment of the blood loss. The right answer is option A. Vaginal examination should be avoided in the case of placenta previa. Question number 117. Most common complication of uterine pregnancy with IUCD insight is option A. Uterine performation, option B. Spontaneous abortion, option C. Premature birth, and option D. Intrauterine death. The right answer is option A. Question number 118. Preterm baby is born before option A. 40 weeks of gestation, option B. 38 weeks, option C. 37 weeks, and option D. 32 weeks. Term baby born between 37 to 42 weeks of gestation. Preterm baby is born before 37 weeks of gestation, and postterm baby born after 42 weeks of gestation. Question number 119. Umbilical cord contains option A. 2 arteries and 2 veins, option B. 1 artery 1 vein, Option C, two veins and one artery. Option D, two artery and one vein. Umbilical cord contain two arteries and one vein. Option D is right answer. Question number 120. A client has been admitted with a diagnosis of severe prosidentia, fourth degree prolapse of the uterus. The nurse plans to assess for option A, edema, option B, fistula, option C, exudate, and option D, ulceration. The nurse plans to assess for ulceration. Option D is right answer. Question number 121. According to WHO, anemia in the pregnancy is diagnosis when hemoglobin level is less than option A 9 gram per dl, option B 10 gram per dl, option C 11 gram per dl, and option D 12 gram per dl. The right answer is option C 11 gram per dl. Question number 122. A birth hazard associated with breech delivery may be option A abruptio placenta, option B cephalohematoma, option C pathological jaundice, and option D compression of cord. A birth hazard associated with breech delivery may be compression of cord. Option D is the right answer. This is the complication of breech delivery. Question number 123. The main objective of antenatal visit is option A to prevent congenital defect in fetus, option B to help to gain birth to healthy child from healthy mother, option C to prevent complication to the mother regarding lactation, option D to provide education regarding lactation. Right answer is option B. To help to gain birth to healthy child from a healthy mother is the main objective of antenatal visit. Question number 124. A nurse teaches women in the fertility clinics that after ovulation has occurred, the ovum remain viable for option A 1 to 6 hours, option B 12 to 18 hours, option C 24 to 36 hours, and option D 45 to 72 hours. The right answer is option C 24 to 36 hours. Question number 125. Ovulation occurs when option A oxytocin level is high, option B progesterone level is high, option C luteinizing hormone level is high, and option D coronary gonadotropin level is high. Ovulation occurs when luteinizing hormone is high and also FSH hormone is high. Question number 126. Safest administrations of drug the nurse should follow right. Option A 4 rights, option B 5 rights, option C 6 rights, and option D 7 rights. Six rights. Option C is the right answer. Question number 127. The nurse assessing the client casted extremity, which finding indicate infection. Option A edema, option B coolness of the skin, option C weak distal pulse, and option D presence of a hot spot on the cast. The right answer is option D, presence of a hot spot on the cast. Question number 128. The first steps to be taken for a client with fracture would be option A reassurance the client, option B transfer to the health facility, option C use of a padding, and option D immobilization. The right answer is option D immobilization. यो क्वेसनहरूको डिस्क्राइब गरिराखेको छुइनँ बिकज अब धेरै सेटहरूमा यो क्वेसनहरू आइसकेको छ र यसको चाहिँ डिस्क्राइब पनि भइसकेको छ 75% क्वेसन पास्ट क्वेसनबाट नै आउँछ सो जति पनि पास्ट क्वेसनहरू छ यदि यहाँहरूले राम्रोसँग सबै सेटहरू रिभाइज गरेर पढिराख्नु भएको छ या पढ्नुहुन्छ भने 100% स्योर यहाँहरूले चाहिँ लाइसेन्स एक्जाममा पास हुनेछ. Question number 129. For correct palpations of a breast during breast examination, the nurse uses her option A heel of, option B index fingers and thumb, option C fingers only, and or fingertips. Always use pads of her fingertips during breast examination. Option D is right answer. Question number 130. For what clinical indicator should a nurse assess? Option A. Client who having a gastric lavage. Option B. Increase serum bicarbonate level. Option C. Increase serum oxygen level. And option D. Increase serum osmotic pressure. The right answer is option A. Client who having a gastric lavage. Question 131. The most common cause of death in a burn case is option A. Hypovolemic shock, option B. Septic shock, option C. Vasovagal shock, and option D. Traumatic shock. The most common cause of death in a burn case is due to hypovolemic shock. Option A is right answer. Question number 132. In adults, intravenous fluid is given if the burn exceeds option A 2%, 10%, 5%, 15%. The right answer is option D 15%. Question 133. In water seal drainage, bottle should be. यो क्वेशन्स रिपिट क्वेशन भइसकेको छ यो सेटमा यसको आन्सर के हुन्छ कमेन्टमा लेख्नु होला क्वेशन नम्बर 134 pulmonary edema is associated with option A right sided heart failure option B left sided heart failure option C myocardial and option D ventricular fibrillation. The right answer is option B left sided heart failure. Question number 135. The nurse understands that a client with dysphagia has difficulty. Option A writing, option B focusing, option C swallowing, and option D understanding. Dysphagia means swallowing. Option C is right answer. Question number 136. If patient is getting streptokinase, what is essential for the nurse to monitor? Option A hypovolemia, option B hypotension, option C bleeding, option D loose stool. Streptokinase means bleeding. Option C is right answer. Question number 137. The main health problem of young adult is option A accident, option B dementia, option C ASD, and option D cardiovascular problem. The main health problem of young adult is accident. Option A is right answer. Question number 138. Chronic health problems are very common in option A adolescence, option B adulthood, option C young adulthood, and option D older adulthood. Chronic health problems are very common in the age group of older adulthood. Option D is right answer. Question number 139. A patient is unable to breathe in horizontal position. It is called option A dyspnea, option B hyperapnea, option C orthopnea, and option D apnea. Option C orthopnea. Question number 140. Before giving digoxin, the nurse assesses option A heart rate, option B blood pressure, option C heart sound, and option D lung sound. Before giving digoxin, the nurse should assess heart rate. Option A is right answer. Question number 141. Women's sign is an assessment used to detect option A venous thrombosis, option B appendicitis, option C peripheral edema, and option D pulmonary edema. Women's sign is an assessment used to detect venous thrombosis. Option A is right answer. Question number 142. The clinical indicator of a patient with a Cushing syndrome is option A menorrhagia, option B buffalo hump, option C dependent edema, and option D migraine headache. Cushing syndrome is a disease that occurs when body makes too much of a hormone cortisol over a long period of time. Cortisol hormone is a stress hormone. And the symptoms is a buffalo hump. Option B is right answer. Question number 143. Echolalia is a disorder of Option A, speech. Option B, hearing. Option C, mood. And option D, perception. Echolalia is a disorder of speech. Option A is right answer. Question number 144. Prolonged use of alcohol in excess leads to option A, cirrhosis of liver, option B, lungs disease, option C, kidney disease, and option D, bone disease. Prolonged use of alcohol in excess leads to cirrhosis of liver. Option A is right answer. Question number 145. Otitis media is the inflammation of option A, middle ear, option B, outer layer, option C, inner ear, and option D, none of the above. Otitis media is inflammation of a middle ear. Option A is right answer. Question number 146. Which is clinical indicator parasympathetic dominance in a client under stress? Option A, constipation. Option B, pimple. Option C, increase GI secretion. Option D, increase epinephrine section. The right answer is option C. Question number 147. The nurse is carrying a client with chronic kidney failure. Which adaptation should the nurse expect? Option A, polyuria. Option B, hypotension. Option C, muscle twisting. And option D, respiratory acidosis. The right answer is option C, muscle twisting. Question number 148. The client with open burn wounds begins to have a diarrhea. The client is found to have a normal temperatures with the WBC of 4000, which is nurse best action. Option A, continuing to monitor the client. Option B, increase temperature in room. Option C, increase rate of IV fluid. Option D, preparing to do work up for sepsis. The right answer is option D. Because of this is the symptoms of a infection. So preparing to do work up for sepsis. Question number 149. A patient has experienced full thickness burn to face and neck. As a nurse, it is priority to option A, prevent hypothermia. Option B, assess blood pressure. And option C, assess airway. And option D, prevent from infection. The right answer is assess airway. Option C is right answer. Question number 150. Sympathetic stimulations of urinary bladder result in option A, contractions of internal urethral sphincter. Option B, contractions of internal sphincters and triggers of bladder. Option C, relaxations of internal urethral sphincter. Option D, relaxations of internal urethral sphincters and trigger of bladder. The right answer is B, contractions of internal sphincters and triggers of bladder. All the best to all. Thank you so much.